I am Dr. Ishwar Gilada, infectious disease expert and currently Secretary General of Organized Medicine Academic Guild and People's Health Organization India. Today we are going to discuss rumour mongering in Covid-19. Our ex-president Pranada Mukherjee is ailing in a military hospital in Delhi, and today morning some fake news came from WhatsApp that he is no more, and immediately condolence message started, obituary messages started, and then we realized that this is a fake news. So why we are in such a hurry that without any authentication we start immediately forwarding messages to people? And just now there has been a Twitter message from his son Abhijit Mukherjee, who says, "My father Sri Pranab Mukherjee is still alive and hemodynamically stable. Speculations and fake news being circulated by reputed journalists on social media clearly reflects that media in India has become a factory of fake news." Why do we want to make India a factory of fake news? WhatsApp is there all over the world, but it is used, it is not abused like in India. It is not only about Pranada today. There has been a lot of fake messages and fake videos, and they are being circulated. They may be not fake, they may be right at particular time, but today they are fake. There is a video message from Nagpur Municipal Commissioner Tukaram Munde, who about 4 months or 5 months before in March said that mask is to be used only by doctors and healthcare workers, not by everybody. At that time there was a shortage of masks, there was a hoarding, people were making black marketing of masks, healthcare workers were not getting masks, and other people were stocking the mask. So at that time it was correct. There is another video message being circulated which is from the World Health Organization WHO, saying that COVID is not transmitted through air, it is not airborne. And that was a message of 9th March 2020. Today we are 5 months after. People are circulating that, saying such and such thing, and people do not want to use masks, they don't want to use social distancing, so they use this kind of excuse for their own way. So we should do all such thing. And it doesn't stop there. There have been also messages of X thing work, Y thing work, this medicine work, HCQS, azithromycin, and lots of medicine, and people went buying. So much so that we doctors were not able to get HCQS for the patients where we wanted to use them. So this kind of hoarding is wrong, and sending messages are wrong. There's one such thing happened about 1979. I was a medical student in Government Medical College, Aurangabad. At 1:15 afternoon, All India Radio suddenly declared a death of Mr. J.P. Narayan. He was called Lok Nayak that time. And Morarji Desai, who was Prime Minister of India, he had done a condolence message in Parliament. He declared he announced the death, and thereafter all over the country, all assemblies were declaring his death and passing condolence messages. But in Maharashtra, Shivraj Patil was a speaker, and he said, "I will not do that till I get an authentic message from hospital concern or a death certificate." And that kind of fake death happened in Jaslok Hospital. And thereafter, he died on 8th of October 1979 in Bihar. So there was a 6-month period he survived. 7-month period he survived. So what do we want to achieve by giving such kind of hurried news and exclusive news somewhere? It is not going to serve any purpose but to create confusion. Fortunately, in Indian culture, if somebody's fake news has come about death and then realize that he has not been died, then they say, "Oh, good, his age has increased." And this is just a cover-up, but it is not to be done. So my request to all of you about COVID-19, whether it is COVID-19 spread, use of mask, use of social distancing, or any kind of new thing coming up, treatment coming, vaccine coming up, all these things will come widely everywhere. So don't believe in one particular WhatsApp or message, and don't start circulating that again and again to people. So stop this rumor mongering, stop this fake news factory. Thank you.